Hello, welcome to FISPGHAN Expert Insight. I am Songpon Getsuwan from Ramathibodi Hospital in Bangkok, Thailand. And today I'm with Professor Yen-Hsuan Ni from the National Taiwan University. Hello, Professor.
Hello. Hello,
Today,
everybody.
hi. Today we're going to talk about hepatitis B infection in children. So, Professor, why does hepatitis B infection acquired during infancy remain a major global health concern?
Yeah, because the complication of the chronic hepatitis B usually occur when the patients become adults. It's a very chronic course, but for the children or especially the infants, they are, I mean, when they acquire hepatitis B, it's very easy to become a chronic carrier. It's quite different. The age-dependent acquisition is a very special feature for hepatitis B infection. If you acquire hepatitis B in infant or newborn or children, it's very likely, like over 90%, the chance you become a chronic carrier. But for the adults, it's more likely you become a acute infection and then you can clear the virus later. But when you acquire hepatitis B in infants, it's very difficult to clear the virus. So you will become a chronic carrier. And all the complications happen to the chronic carriers. Here, the complications include cirrhosis and especially hepatocellular carcinoma. That's a liver tumor. So that's the worst complication of chronic hepatitis B. So come back to your questions. We have to give the vaccination right after birth because it can prevent the infant to acquire hepatitis B, and after that, you can minimize the chance to become a chronic carrier. So that's the reason we have to emphasize the importance of the infant universal vaccination against hepatitis B virus.
Well, thank you, Professor. So I think it is very important message that we would like to convey is that the hepatitis B vaccine should be given to all children within 24 after birth. Am I right?
Yes, exactly.
And in your opinion, what could be the key challenges in managing patients, especially children with chronic hepatitis B infection?
I think there should be two parts. One part is prevention. The other part is treatment. For the prevention part, I think right now in Taiwan is quite high. Complete, that's a three dose vaccination schedule. Especially for the first one and two. The first one is 24 hours after birth, and the second dose will be 1 month after birth. The third dose usually is 6 months after birth. So you have to follow up the patient to give them the complete 3-dose vaccination schedule. But at least I think the 24-hour the first dose is really important. And for those countries who still do not have the universal vaccination programs, I think it's quite a challenge to miss those patients, especially in the endemic area for hepatitis B. For example, like some countries in Southeast Asia or Africa. That would be a big challenge for the public health because they couldn't provide the universal vaccination program. I think the most challenge for the prevention is the implementation of public health force. In Taiwan, we always check the all the infants' health book. We have a vaccination record, and if you miss any dose, the public health workforce will contact you, and they everything is under computerized recordings. So if you miss some of the vaccinations, the public health workforce will contact you and to see if we can provide any help to help you to catch up all the vaccinations. But if the public health workforce cannot offer this kind of service, I think it will be difficult, and there will be some cases miss the vaccination program. And the second part will be the treatment. You know that because most of the new clinical trial, they are only be done in adult patients. So sometimes it's difficult to perform the clinical trial, especially the new medicine or new antiviral agent, to perform this kind of a clinical trial in children. And because the success of the universal vaccination, the carrier children become less and less. So most of the pharmacy, the drug companies, they don't want to do the clinical trial in children. So it's there are very few medicines, antiviral agents, which can be indicated for the chronic carrier children. But anyway, I think because the vaccination or the prevention actually is much more important than treatment. I think we hope that we can have no such patients instead of treat them. So I believe maybe in the future for those who still vaccine failure or they didn't receive the adequate vaccination and got hepatitis B infections, I think we still can follow the adult experience and give the patients some adequate treatment. Yes, that's my answer.
Well, it's been a great pleasure talking to Professor Ni today. So thank you everyone for watching, and see you next time in FISPGHAN Expert Insight. Bye-bye.
Bye-bye. Thank you.